Good morning, everyone. I'm Joaquin Esquivel, Chair of the State Water Resources Control Board. Today is Thursday, January 20th. It is 9 a.m. and we can bring this meeting back into order. I'll begin by introducing my fellow board colleagues. With me here today is Vice Chair Doreen D'Adamo, Board Member Laurel Firestone, and Board Member Nicole Morgan. Joining us as well is our Executive Director, Eileen Sobek, our Chief Counsel, Michael Laufer, our two Chief Deputies, Eric Oppenheimer and Jonathan Bishop. Our clerk of the board is Janine Townsend, and assisting her today is Margie Argel and Courtney Tyler. As you can see, this meeting is being webcast and recorded. We don't have a physical meeting room in order to continue to keep all of us safe from COVID and continued concern. That will be here, I'll just mention at the top, extended until March 30th. So we will continue to have a virtual meeting room here for the board members until then. And because of it, you need to be here on the platform if you intend to speak on any item here before the board today. The rest of our agenda has only one item. So if you're here to speak on the intended use plan and you're on our customary streaming service on YouTube or on our website, please do refer to the link at the top of today's agenda and or our website to be able to get onto the Zoom platform here. If you're having any challenges with that, submitting an information card and getting the link, you can email our clerk of the board, Janine Townsend, at waterboards.ca.gov, and she can help you get onto the platform. Once you're here, your camera will be off and you'll be on mute until it's your time to speak on an item. Because this is the second day of our board meeting, we already did public forum yesterday, so we can get straight into our item this morning. So just to flag, there will be something of a kind of two-part dance here. We're considering a lot, but it's all around our intended use plan, both on the clean water side, which we'll have a presentation separately from then our drinking water side in order to keep a discussion, but we'll consider it all here as part of one item, along with draft implementation plans for administering wastewater and drinking water allocations from the budget. So with that, I'd like to turn it over to, I believe, Bridget or one of our other presenters. Good morning.
Good morning. Thank you. Good morning, Chair Esquivel and members of the board. My name is Bridget Chase, and I'm a supervising engineer in the Division of Financial Assistance. The following slides will go over background details on the Budget Act of 2021, details on previous stakeholder meetings on this funding, and our proposed implementation plan for the funding. As you mentioned, I'm going to start off with the drinking water side. We'll pause for any comments on that, and then I'll start talking about the clean water side or the wastewater side. Next slide, please. So the Budget Act of 2021 allocated $1.55 billion to the State Water Board through Senate Bill 129 and Senate Bill 170. Today's workshop is to discuss DFA, or the Division of Financial Assistance, draft implementation plan for the $1.3 billion that is allocated to drinking water and wastewater projects. $650 million is available for drinking water projects with priority given to disadvantaged communities, and $650 million is available for wastewater projects with priority given to septic to sewer projects with local investment. Because up to 5% of the funds may be used for administrative costs, approximately $617 million will be available for grants under each funding program. In addition, up to 10% of the drinking water and wastewater funds may be used for technical assistance and capacity building in disadvantaged communities. These funds need to be committed to projects by June of 2024 and dispersed by June of 2026. So there's a quick turnaround time. For this reason, the State Water Board adopted resolution number 2021-0030 on August 18th of 2021 that delegated necessary authorities for DFA to encumber and award an initial $100 million from each allocation. Since then, DFA staff have been working with stakeholders on the implementation plans for the remaining funds. Next slide, please. DFA staff coordinated with the Division of Drinking Water, the Regional Water Quality Control Boards, drinking water and wastewater system representatives, environmental justice groups, technical assistance providers, and other stakeholders to develop the draft implementation plans that I'm going to go over today. In October, we held a public meeting with wastewater stakeholders, and then in November, we solicited input from the SAFER Advisory Group, followed by a public meeting with larger drinking water stakeholders. Next slide. DFA staff are proposing to rely on existing funding processes that are outlined in the Drinking Water State Revolving Fund, or Drinking Water DWSRF, and the Clean Water State Revolving Fund, or I'll refer to that possibly as CWSRF, intended use plans or IUPs. As amended, the basis for administering the remainder of the drinking water and wastewater allocations from the Budget Act of 2021. If adopted, the amended Drinking Water SRF IUP and Clean Water SRF IUP would serve as implementation plans for the drinking water and wastewater allocations from the 2021 Budget Act, respectively. The amendments to the IUPs are proposed to streamline funding processes and maximize opportunities for eligible projects. If adopted, the proposed amendments will apply to multiple funding sources currently administered under the intended use plan or intended use plans, not just the allocations from the Budget Act of 2021. We also wanted to acknowledge the significant influx of new federal funds to both the Drinking Water SRF, Clean Water SRF programs that will result from the recent Infrastructure Investment and Jobs Act. Plans for administration of the federal funds will be incorporated into the 2022 and 23 IUPs, which will come before the board for consideration of adoption this summer. So that's a separate issue than today. The budget bill specified that the state funds that are being discussed today may be utilized as state match against federal funds. At this time, DFA staff are not proposing to commit any of the general fund money to match federal funds. This need will be further evaluated, however, and additional recommendations may be incorporated into the proposed amendments to the state fiscal year 2021-22 IUPs, or more likely the state fiscal year 2022-23 IUPs, which will be considered again this summer. Draft amendments to both IUPs were posted for public comment on January 6th. Today, we will again first run through a summary of proposed changes to the Drinking Water SRF IUP, and then we'll accept public comment on those proposals for drinking water projects. Then after that, we will summarize proposed changes to the Clean Water SRF IUP and accept public comment on those proposals for the wastewater projects. Written public comments will also be accepted through February 7th of 2022. So if you can't comment today or you just want to put it in writing, we'll still accept those for sure. After review and consideration of comments received, proposed amendments to the IUPs are scheduled to go to the board for consideration on March 15th. Next slide. The following 7 slides will discuss proposed changes to the Drinking Water SRF IUP. So I will start off by defining some of the terms that we use in this discussion. A disadvantaged community, or DAC, is a community with a median household income, or MHI, of less than 80% of the statewide MHI. DFA utilizes the American Community Survey, or ACS data, set to determine the MHI of a community. ACS data is updated annually using a 5-year rolling average, with new ACS data utilized by DFA as of April 1st of each year. So I'm going to talk about our current data, but again, we're going to have that updated as of April 1st. Currently, data defines a disadvantaged community as a community with a median household income of less than $60,188. A severely disadvantaged community, or SDAC, is a community with an MHI of less than 60% of the statewide MHI, or according to our current ACS data, less than 45,141. For drinking water projects, a small community is one with up to 3,300 connections, or 10,000 people. An expanded small community serves more than 3,300 service connections, but no more than 6,600 service connections, or a population of more than 10,000 people, but no more than 20,000 people. And then finally, we are proposing adding a new definition for medium disadvantaged community. This would be a community that serves between 20,000 and 100,000 people. Next slide. So just a few more definitions before I jump into the proposed changes. Eligible non-transient non-communities, or NTNCs, are considered systems that serve a public or nonprofit K-12 school. Daycare facilities, labor camps, elder care facilities, and healthcare facilities may also be eligible non-transient non-communities. Consolidation is considered the joining of two or more public water systems, state small water systems, or affected residences not served by public water systems into a single public water system. Lastly, proposed grant funding for the drinking water side is split by project type. The drinking water SRF policy defines eligible project categories A through F. We will refer to category A through C projects, and those are projects that address public health issues. So examples of these kinds of projects include those that will address waterborne disease outbreaks attributable to the water system, contamination in excess of the maximum contaminant level, or MCL, insufficient source capacity or water delivery capability, surface water that is not adequately treated or filtered, or uncovered distribution reservoirs. Then category D through F projects are eligible projects not listed in A through C. So projects might include water meters, community water systems with a single source and no backup supply, distribution of water that exceeds secondary standards, and distribution of water in excess of published chemical notification levels. Next slide. So DFA is not proposing any changes to the existing grant criteria for planning projects. 100% planning grants are available for small disadvantaged communities only, but the Deputy Director of DFA may, however, approve planning grants for small non-disadvantaged communities for good cause. There is no cap for planning grants, but any grant funding received goes towards the total grant cap that community is eligible for in a 5-year period. So these caps are for all grant funds received through planning, technical assistance, and construction funding. Next slide. This slide is specific to proposed grant criteria for category A through C, or consolidation projects. As mentioned previously, A through C projects are those that address a public health issue such as a primary MCL exceedance or water shortages. The draft proposal makes 100% grant funds available for disadvantaged communities with a population of up to 100,000 people and eligible non-transient non-communities that serve a DAC. So again, maybe schools would be eligible. In addition, small non-disadvantaged communities with a median household income of less than 150% of the statewide MHA may also be eligible to receive 100% grant for these project types. So going back to our ACS data, a small non-DAC would have to have a median household income of less than $112,853 to be eligible in this case. Projects may receive a maximum of $60,000 per connection. For small and expanded small disadvantaged communities, there is no project cap. However, medium communities and small non-disadvantaged communities would have a project cap of $20 million per project. The current drinking water SRF intended use plan allows for 75% grant for expanded small disadvantaged communities and small non-disadvantaged communities. We are proposing making these systems eligible for 100% grant to encourage additional consolidation projects and reduce application processing time for systems experiencing serious drinking water public health issues, since fewer factors would need to be reviewed and considered if there is no loan involved. Then medium disadvantaged communities are proposed as a new eligible community type for these category A through C and consolidation projects only. Staff compiled a list of systems that might be eligible as a medium disadvantaged community, as we were considering adding this as an eligible system. And we found under 10 systems that we think would be eligible. When discussing proposals with stakeholders, there was some concern about taking funding away from small disadvantaged communities. For this reason, we included the language in the proposal that gives smaller disadvantaged communities priority for funding. This is also why we included a project cap of $20 million for eligible non-disadvantaged communities and the medium disadvantaged communities. Next slide. So this slide shows construction grant funding for those category D through F projects. Current grant funding is available for category D through F projects for small disadvantaged communities and expanded small disadvantaged communities only. So again, that goes up to that 20,000 population. Small severely disadvantaged communities are eligible for grant funding regardless of their drinking water rates, but other communities are currently required to have rates of at least 1.5% of their median household income in order to qualify for these grants. The proposed amendment would remove the minimum drinking water rate requirement for small disadvantaged communities to qualify for these grants. The proposal also allows 100% grant for all small non-disadvantaged communities and eligible expanded small disadvantaged communities with rates of at least 1.5% of their median household income. Expected benefits are similar to those discussed on the previous slide. By removing the loan component from these projects, we anticipate that processing time will be improved and requirements will be reduced for these systems. Some stakeholders wanted to keep the minimum drinking water rate requirements to qualify for grants, even for small disadvantaged community projects, but others thought we should have maximum flexibility. The concern over rates seemed to be related to making sure that rates are sufficient to operate and maintain the system. DFA is proposing to not include water rate requirements because we want to streamline this funding for the disadvantaged community systems. It should be noted, however, that DFA does confirm that rates are sufficient to operate and maintain a system as part of the construction application review process. Next slide. The Drinking Water SRF intended use plan makes incentives available to receiving water systems. So the larger water system that's going to take on a smaller water system to encourage consolidations. A public water system that fully consolidates a community of at least 15 connections or 25 people may receive up to $10 million in 0% financing towards an incentive project. When I talk about an incentive project that is separate than the actual consolidation project, it is a project that solely benefits that receiving water system. So, you know, if they need to install water meters, for example, or something like that, it could be their incentive project. The receiving water system may also receive up to $5 million grant towards their incentive project, depending on the size and the type of the community that's consolidated. The proposed amendment clarifies that a receiving water system may receive additional incentive funding if they consolidate multiple systems or communities. Subsequent to initial stakeholder meetings, staff realized that there should also be incentive offered for consolidating non-disadvantaged systems. Therefore, staff added language to make incentive funding grants available if the receiving water system consolidates a small non-disadvantaged community as well. And language has also been added to clarify that the receiving water system must be a voluntary participant rather than part of mandatory consolidation to qualify for this funding. We're proposing that the executive director or designee can approve a case-by-case exception for good cause to that. Next slide. The following edits were also added after the stakeholder meetings to clarify key points related to consolidation funding eligibility. So firmer language was added to emphasize that consolidation life cycle cost and feasibility must be considered, and where it is feasible, grant will only be provided for the consolidation project. The drinking water SRF intended use plan already indicates that if a receiving water system does not have sufficient capacity to serve the additional customers or the subsumed water system, grant funding may be available to increase water supply capacity. Language has been added to clarify that as part of a consolidation project, reasonable and necessary connection fees or source capacity fees are also eligible for grant. We made the rules for funding infrastructure on private property more clear as well, both for mobile home park consolidations or other private for-profit consolidations, and for projects to connect domestic wells or state small systems. So we clarified that work on private property for public water system consolidations, such as mobile home parks, can be grant eligible for facilities that the receiving water system will own and operate. Other work on private property will be subject to DFA review of the owner's ability to pay in order for it to be potentially grant eligible. We also clarified that for connecting domestic wells, work on private property such as laterals, well destruction, and backflow prevention can qualify for 100% grant based on the median household income of the community connecting. However, if cost per connection for an individual home is significantly higher, DFA may limit grant funding case by case. So this is the last slide that I have on the proposed amendments to the drinking water SRF intended use plan. Staff are available to answer any questions and will accept any public comments on the proposed drinking water implementation plan at this time.
Thank you so much, Ms. Chase. Really appreciate the good overview. I know that our item here didn't parse out a drinking water or clean water category for comments, but we'll just note that I think we only have 2 commenters, so this shouldn't be too hard. But if folks are wanting to comment here on the drinking water component, please do just raise your hand and we can then put you in the queue for comment here. And then otherwise, look to my fellow board colleagues if they have any questions or feedback from the presentation here.
Yeah, thanks. I actually have a bunch of questions just to clarify, because I know you went through this fast and there's a lot. So let me just go through. So this is an IUP amendment, which means, as you said, it's for all, it would affect all the current funding that's subject to the IUP and this new state funding, which is the highlight here. Can you just remind us what other, is it just SRF, both principal forgiveness and loans that would be affected by this IUP update, or are there other, in addition to that, are there other funding sources that would be amended or affected to, so the state, SRF, and are there any others that are subject to the IUP?
Yeah, so we put a lot of our drinking water funds through the drinking water SRF program. So any proposition funds that we have, like any remaining Prop 1 or Prop 68 is also in there. And I think those are the main things.
Okay, great. Oh, okay, thanks. I thought there were others, so that's helpful to help me clarify. Okay, and then related to that, and this may be follow-up just for as we finalize. You know, obviously we, through the SAFER program, we do this pretty extensive fund expenditure plan, and it's one of the things I really appreciate about that is that it lays out all the other funding sources, all the potential funding sources for SAFER projects, not just the Safe and Affordable Drinking Water Fund. So I think if we could see whether the demands and needs that we're estimating or predicting through the fund expenditure plan, through the SAFER program, are likely to, or are able, just in terms of the quantity, I know that they're all eligible, but would be able to be covered by this existing funding, and then how much is left over from that. So in other words, if I think the intent is always, we want to prioritize the safer program priorities and identified in the fund expenditure plan. And we look at that holistically as, pulling in all of our funding sources, which, like you said, are pretty much, the other ones are governed through this IUP essentially. So just understanding how the demands that we're predicting to cover those safer projects, if we were able to fully fund that through all of these, how much would be left over to fund these additional important priorities and projects that we've identified that would be eligible through this, just to understand kind of the order of magnitude here and help just inform the the kind of full implications of these expanded eligibility. So I don't know if you have that now, but I assume that that's something you could do as a follow-up.
Hi, Laurel. Yeah, we can do that. We also have some additional slides that they don't necessarily get specifically at the demand quantified in the FEP. So that's something that we can work on, but they do sort of quantify existing partial applications and that sort of thing to give a sense of what that looks like. So Janine, would you mind pulling that up?
Great.
So we can talk through this quickly. So essentially these are potential applications. They're not necessarily complete. We'll be working to try to help folks complete those. And we also, of course, want to bring in new applications, including, planning applications to help folks gear up to be ready for the federal funding if they're not, in the timeline that we can fund them with this state money. So we have a total of about 511 million in pending wastewater applications. Those are primarily in construction. About 500 million of that is in construction. And then for drinking water, we have about 655 million. That, again, of course, the majority of that's in construction, 620. And then we tried to provide a little bit of a breakdown of how that falls out with the different priorities we have in the IUP. So, about 400 million of that is for category A through C construction projects. And the large majority of that, 350 million, is for either small DACs or expanded DACs. And then about 50 million is for either small non-DACs or medium DACs, which are some of the newer eligibilities that we're proposing. And then another 220 million for category D through F projects. And that's specifically for small and expanded small DACs, because that's the only eligibilities we're proposing for that. And then there's one more slide, Janine, if you don't mind advancing. This is not quantifying things in a dollar sense, but just to give sort of what kind of latent demand might be out there, in particular with some of the new eligibilities we're proposing. And so for human right to water and at-risk systems, around 75% of those are small DACs, and 230 are small non-DACs. And most of those would qualify for grants with a median household income less than 150% of statewide. And then again, we already mentioned that there's relatively small number of medium DACs that are likely to qualify. And then we also coordinated a bit with Division of Drinking Water about the consolidations that they're working on. And, the majority of those do qualify as disadvantaged, and around 30 are in that non-DAC, with most of those, again, qualifying for grants because they're less than 150% of the statewide median household income. And so, some of those in that second group are obviously counted as part of the human right to water and at-risk systems, probably most of them. There may also be some in that group that are just sort of located in a good way to participate in regionalization efforts that are going on and that sort of thing.
Great, that is so helpful. Thank you. So let me just, with those two, summarize some of my takeaways, make sure I'm taking away the right thing. So it makes sense for us to expand for that first part. It makes sense for us to expand eligibility for 100% grant for the small non-DACs for and medium DACs, at least for both the A through C projects. A through C projects, would the at-risk systems fit into A through C, or are those really the human right to water system is going to fit through for?
I would say it parallels closer to the human right to water systems.
Yeah. Okay. So, but I think if we're going to prioritize those, trying to make progress and the highest priority for human right to water systems, for example, then we do need to expand to small non-DAC in order to hit those, because there's 230 of them on the human right to water and at-risk systems. So that is helpful for me to understand, and then the medium DACs as well. So those are both expansions we're proposing here and would help us get to all of those highest priorities of human right to water system and at-risk systems. Okay, so that's, and then secondly, on the consolidations, if we want to get the ones done that are on track, and that's a priority for us as consolidations, then there is some significant, 30 that are non-DACs. So I think so the idea is the expansion that we're proposing here to allow for 100% grant for non-DAC consolidations would allow us to get to those 30 systems or move those forward more quickly and smoothly. And all of this is, well, actually, can you go to the slide before? So these are the applications in process. So all of the funding we're talking about today really has 2 years to get encumbered, right? Or less at this point, realistically, because it has to be encumbered, or maybe not less. I don't know. It has to be encumbered by 2024, and not liquidated until 2026. But they have, say, about 2 years to get their projects in contract. So mostly what we would realistically be able to fund, or the projects that may realistically be able to get all of that done, the majority are these that are already in process, because they're more likely to be able to have all the things they need to be able to get contracts. And certainly, if others can get this together in that time, then there would be additional ones. But I think this is really helpful to see kind of the ones that would be most ready to go and therefore most likely to be funded. Is that right?
Yeah, I think that's fair. And I also, just for those listening, don't want to make them feel discouraged that they can't come in and get applications in and complete and compete for the funds too, because especially considering that we have that federal funding coming down the road. So, yes, we just encourage folks to come in and work with us if they have eligible projects. But yes, I think you're right that on the timing that, it's very tight, and we, folks need to complete their applications soon to be able to compete in the timelines that we have.
Right. So there may be, folks that are in planning, for example, or have projects, if they can get everything together within less than 2 years to be able to get through the contracting process, but it's pretty, it means they'd have to really expedite that to get that going. So just in terms of understanding how much the funding that we have that we're talking about could cover just from these, what you have here, the applications that are already in progress. So based on the numbers of funding that we're talking about here, it seems like, if we're talking about 650, if we include the 100, well, say it's 550. Okay, let's say it's 650 is the new state funding in each wastewater and drinking water. So that is pretty close to needing to, is what would be necessary to cover what we already have in applications laid out here. So that doesn't include the SRF principal forgiveness and the, what other propositions are left. But in other words, I'm trying to just understand beyond these applications in process, how much money would really be left over in the funding pots that this IUP would be applying to. Does that make sense? What my question is.
Hi, Megan.
Joe, you want to go ahead? Yeah.
Oh, sure. Yeah, I just pulled up our fund expenditure plan, which had a lot of the complementary funding. So, the information is older, but still gives you some kind of round numbers. So we had like 50 million plus in principal forgiveness left. So that's what, as of June 30, 2021. So that's changed. And then, 70 million-ish in bond funds. So certainly, the other thing, and Megan, you can correct me if I get this wrong, but, in our fund expenditure plan, to the extent that we fund construction or planning projects using safe and affordable drinking water fund, we refer to the criteria in the IUP, to make sure we're consistent.
Okay, so that's another funding source that the IUP was relevant to. Yeah.
Yeah, and just sort of, we're, don't want to be the spoiler here about our federal infrastructure funds, because that will be another discussion. But it is just for kind of the base eligible projects with drinking water SRF. We're looking at like up to $2.3 billion over 5 years, and roughly half of that would be available for principal forgiveness. So that might give you a little bit of sort of context. Yeah, and comfort. It's like,
yeah,
and Megan kind of alluded to that, is like, don't feel like this is all we have, and don't be too concerned about the, the timelines for this particular pot, because there's more coming. Get those projects in so we can start working with you.
Okay, great. So what is, and these dollar amounts, the total for each of these, so say 655 million for drinking water, this is what, in terms of current applications, would be eligible under these changes that we're considering today, right? Yeah, that's right. Okay, so in other words, we could cover all of these and have some money left over even before we get it, especially if we're counting the additional principal forgiveness and bond funds, we would have some money left over even before we get to the new federal infrastructure funding. So that could be available for new projects coming in or ones that aren't on this list. Is that right?
Yeah. And some of these lists will move more, some of these projects will move more slowly and give others an opportunity to come in and quickly, it's all a balancing act as we go.
Yeah. No, for sure. And I agree. I don't want to suggest that all of these will definitely get funded because they have to go through the process, or that there aren't new ones that that can and should come in. This is more just kind of gut check for me and understanding the implications of these changes. Okay, other clarifying questions I had. Can you just go over again for me what non-DACs are eligible for under these new expanded, what changes that means that applies to non-DACs that would move to 100% grant. So I remember, if you can just summarize that again for me. I was just kind of getting lost in some of these. So my memory is it's still just small non-DACs, and it is for consolidation or A through C projects. But can you just clarify what is eligible for non-DACs?
I could jump on there. So you're correct. It would have to be a small non-disadvantaged community. One thing that we did add in the proposed amendments is currently small non-disadvantaged communities can be eligible for these project types for up to 75% grant. So we're planning on just changing that to 100% grant. Also, the current intended use plan does not have a median household income cap, and we're proposing adding a cap of 150% of the statewide MHI. So it's not going to get those really wealthy communities, but rather it's going to be the ones that are up to 150%, which currently is 112,853 median household income.
Great. Okay. Thank you. That's really helpful. So, so one of the things I've been thinking about a lot is, you know, we're going to be considering more quickly here, Chrome 6 MCL. And in terms of eligibility, if we have, say, a new MCL like Chrome 6, that would mean that that systems that have that problem would fall into the A through C projects, right? And so therefore, all DACs through the medium size systems would be eligible for 100% grant, and small non-DACs with that problem would also be eligible for 100% grant with this income cap. So it would just be for non-DACs, it would just be up to 3,300. I forget what the size is for the non-DACs. Can you sort of clarify, if there's a new MCL, who would be eligible under this?
Yeah, so it would be the same thing. If there was a new MCL and the systems were out of compliance, then they would be eligible as category A through C. So again, it would be disadvantaged communities up to that medium size, so up to the 100,000 population, as well as small non-disadvantaged communities, small is less than 3,300 connections or 10,000 population.
Great. Okay. Thanks. And also just to understand, because if we may not be able to know this, but if we adopt an MCL that has either a compliance period or some delay in before which they're actually in violation. So sometimes there's some, either we purposely put in some delay and compliance period when we adopt the MCL, or just by nature of the averaging over a monitoring period, folks are not yet issued a notice of violation for a new contaminant. Is it defined, or is there a restriction that through this that would mean that those wouldn't be eligible for A through C priority? Do you know what I'm asking?
I think so. Yeah. So you're basically asking, do they have to officially be in violation to qualify for the 100% grant, right? Would they be considered A through C? You know, I'm going to punt on that one. I think we need to talk to like DDW and our attorneys as well. I'd say in general, you know, the projects we look at is when there's a compliance order, right? You know, so there's, you know, they've exceeded the MCL over the averaging period. You know, it's not necessarily about there's a trend or anything like that. But I'll need to confer with folks on that. I do think, you know, just to sort of raise another issue that I don't think we can address here per se, but will be relevant, I think, to your discussions around hexavalent chromium. Like, to the extent the MCL ends up higher than, say, the public health goal, that's another issue that isn't really expressly addressed, right? So in those cases where maybe a given system says, hey, we understand the MCL's here, the public health goals here, we would like to treat, you know, down to the public health goals. So I think that's another thing, you know, we need to look at, but is not expressly addressed in these particular proposed amendment or the policy. That's the other thing we have to look at, is there's a drinking water SRF policy and a clean water SRF policy.
Joe, on that, have you ever had a system on any other MCL try to come in lower than what we have, but closer to the public health goal?
Well, I
look
know,
for funding.
Yeah, and you know, Megan can correct me if I'm wrong, but I do remember, you know, before the hexavalent chromium MCL was set aside, you know, there's that kind of period where we had a number of projects that were pending. And then as soon as they was set aside, then we basically said, okay, we can't fund that project. You're not meeting those criteria. And they certainly could have come in and, you know, asked for loan and that sort of thing. So did I answer your question, Joaquin?
That's fair. Yeah. I think
Okay.
somewhat. Yes, something of an example that you saw here with Chrome 6, but yeah, I was just wondering. Yeah.
Yeah, the other one that's
for arsenic is so far, the MCL is so far above the public health goal. So like if you have you know, rather than the MCL of 10, if a community had levels of 8 or 9, but wanted to fit under the A through C priorities, whether that has been done before.
Yeah, I don't think so. I don't think they'd fit under the A through C priorities, but Megan, you can jump on it. Have you seen anything like that? I can't recall seeing.
With what you're saying, Joe, that we generally wouldn't count them as in violation at that point. And so they wouldn't qualify as A through C projects.
Okay, great. Well, so this is something it sounds like we can follow up on with the attorneys and DDW, just to kind of understand how that might be dealt with and where that fits. Does this fit in the IUP? It sounds like maybe not. This is something that's dealt with maybe through other policies or guidelines, but would be helpful to follow up on that. Okay, let's see if I've gone through all of mine. So one thing I caught, which I just wanted to clarify, was there's a cap. When we talked about planning grants, Bridget, you mentioned that goes to a total project cap, and that would include planning and construction, obviously. And then you mentioned TA, and I think maybe there was other things. I'm assuming that if TA is done through another entity, through a work plan, does their work plan costs still go towards this project cap? Or is that just for grant, like a total grant cap that goes directly to that system or project? Can you clarify that?
Yes. So what you're referring to is if if we had assigned technical assistance to a provider to either fill out an application or do some of the planning work, maybe a feasibility study, environmental documents, that type of thing for a project, would we count those costs towards the total project cost? Yes, we would.
Okay.
So it'd be planning costs, any of the costs associated with the technical assistance provided, and construction would all go towards that.
Okay. And I'm assuming an administrator costs wouldn't. I don't think you mentioned that one, but just.
I don't believe so, but Megan can correct me if I'm wrong on that.
Yeah, I mean, we have not been counting it to date.
Yeah, that makes sense to me. Okay. Great. I think those were all of my clarifying questions. Thank you so much. And I do want to hear from stakeholders, but I'll also just say I feel like this is just such a thoughtful way of trying to expedite projects that are the highest priorities and get them through without kind of creating unnecessary barriers, but still being thoughtful about how to make sure the funding goes to those that need it most. So really, really appreciate it, and look forward to hearing more from stakeholders.
Thank you, board member, for the good questions, and for program folks for having these really great breakdowns already, particularly around, again, what is the need total here? Are we going too far? Because a lot of these restrictions in place, importantly, because there hasn't been a surplus of funds, and we've had to really try to best target them here. Really fortunate for this truly generational moment we have at the state level, but then also the federal level, to loosen those and change them, because we're not as constrained as we were previously, and can really start to make headway. So thank you, board member. Other colleagues with questions here on the drinking water side, and please do raise your hand. I think we only have a couple of commenters, Jared Voskel and Matthew Trevor, more likely to be commenting on the wastewater side. But if you have drinking water comments, please raise your hand and I'll call on you here. And then otherwise, looking to my fellow board colleagues if they have any more questions. Okay. Matthew Trevor, please.
Thank you, Mr. Chair. Just appreciate the opportunity, and this has been very informative. And so we've got a lot of work here. Again, my name's Matt Treber. I guess it says it on the screen there. I'm the Chief of Development Services for Madera County. So Bridget, thank you very much for the presentation and all your efforts here in Madera. You and your team have been great to work with. And so just appreciate the opportunity. Got a lot of questions, but we'll probably be plugging in with Pete and Matt and those folks, and Bridget on your team there. So just appreciate the opportunity. Thank you for the information.
Yeah, thank you incredibly. And yeah, note to everyone as well that the written comment period is, I think, open here to February 7th, I think we said. And folks can correct me, please, if I'm wrong on that. So please do, if you have more thorough comments, submit them in writing. We'd love to hear them. This is, again, an incredible moment when it comes to just the dollars and resources we have. We want to make sure that we're doing right by it. And so appreciate everyone's eyes and feedback, and making sure that we're getting it right here. So thank you, Mr. Trevor, really appreciate it. Okay, we can move on then to the wastewater discussion if there isn't anything from other colleagues. Okay. Thank you. Then now we'll dive into the wastewater, clean water, SRF and IUP. Ms. Chase. Oh, I apologize. You're muted still.
Thank you. If the original presentation that was out could be pulled back up to slide 12, that would be great. Awesome. Okay, so I will now summarize proposed changes to the Clean Water State Revolving Fund intended use plan for the wastewater appropriation from the Budget Act of 2021. So the Clean Water SRF program has a different definition for small communities. For wastewater projects, a small community is a community with a population of less than 20,000 people. 100% planning grants are available for small disadvantaged communities. The proposed amendment would eliminate the current planning grant cap of $500,000. This change is anticipated to be able to fully fund the necessary planning for a project, so applicants won't have to apply for additional funding from other agencies or hold off on doing some of the planning until construction, for example. Similar to the drinking water SRF intended use plan, planning grants would count towards the total cost a community is eligible for over a 5-year period, and that includes the planning, technical assistance, and construction funding. So that already is in place. The only thing that we're proposing changing is removing the cap for planning grants. Next slide, please. The current intended use plan shows that grants are available to small disadvantaged communities. Many projects have a grant loan split currently that depends on consideration of degree of which the community is disadvantaged and what their wastewater rates are. The proposed amendment to the IUP would provide 100% grant funding for small disadvantaged communities regardless of their wastewater rates. The proposed amendments will remove the maximum grant per project limits. Rather, grants for small disadvantaged communities would only have a maximum grant per household connection, similar again to the drinking water side. In addition, the proposed amendments would increase the maximum grant per connection for septic to sewer projects from 100,000 or to 100,000 and other projects to 45,000. So I do want to point out that last year we had approximately like 55 million available for grants in the Clean Water State Revolving Fund program. So these changes seem pretty significant, but it's because we have such a large amount of grant funding now available. So removing this loan component can potentially reduce requirements for small disadvantaged community projects and reduce the need for co-funding with other agencies. Fewer projects are anticipated to get stuck for communities that struggle to demonstrate capacity to repay loans, and application processing time is anticipated to be reduced as well. Next slide. Per the Budget Act of 2021, the State Water Board shall prioritize septic to sewer conversions with local investment for wastewater projects. The proposed intended use plan amendment creates a new septic to sewer set aside of $350 million to be funded solely with Budget Act of 2021 General Fund Wastewater Infrastructure Funds. The proposal would allow projects for small disadvantaged communities to receive grant funds on a first come, first served basis as applications are complete. Then any funds remaining will be available to larger disadvantaged communities or small non-disadvantaged communities that have wastewater rates of at least 1.5% of their median household income. The grant criteria for these communities would be limited to 50% of the total eligible project cost. In addition, grants for large disadvantaged communities and small non-disadvantaged communities would have a maximum grant per connection of 50,000 rather than that 100,000, and a maximum grant per project of 45 million. Per the proposed intended use plan amendment, larger disadvantaged communities or small non-disadvantaged communities that are interested in applying for the remaining or any remaining septic to sewer set aside funding must at a minimum complete and submit a Clean Water State Revolving Fund general application for their project by November of this year. A complete application would need to be submitted by March of 2023. And then because of the quick timeline associated with these funds, projects will need to start construction by spring of 2024 and complete construction by the end of 2025. The Deputy Director will also prioritize projects that address impacts to water quality and may offer only partial funding if demands exceed available funds. The set aside will reserve funds for septic to sewer projects that can often take longer to develop. Stakeholder input received thus far has been supportive of the set aside, so long as the focus is on small disadvantaged communities. Because small disadvantaged communities will be eligible to tap into the set aside funding as their applications are complete, they will have the opportunity to compete for funds ahead of other communities. So this is the last slide that I have on the proposed amendments to the Clean Water State Revolving Fund intended use plan. Staff are available again to answer any questions, and we'll accept any public comments on the proposed wastewater implementation plan at this time.
Thank you, Ms. Chase. Really, really appreciate again, likewise, good work on being thoughtful and here taking advantage of an incredible opportunity we have. Where I was concerned about some of the timelines needed for this current tranche with the drinking water side, less concerned, I'll say. I am a bit more concerned here on the septic to sewer, knowing that these can be hard projects to get in, and just kind of wondering what the pipeline is currently of septic to sewer projects. And here, yes, similarly, we have another tranche coming on the federal side, but less of an emphasis there, I guess, on those sorts of projects. And just kind of wondering what will be our ability to fund many or how many perhaps by the cutoff for at least this tranche, the state amount that has this emphasis for septic to sewer. Do we have, I know we had numbers similarly for on the wastewater side, but I wasn't sure if those were septic to sewer projects specifically in the breakdown, or at least I didn't pay as much attention there. So yeah, just wondering if, how many septic to sewer projects we think are likely to be in the pipeline now, and just concern of, some pretty tight timelines here for those grants.
Yeah, so the previous presentation I had the numbers didn't have the septic sewer breakdown.
Okay.
The last that I checked, we have about 150 million in applications currently for that for small disadvantaged communities. We only have 2 applications that would potentially be eligible for larger disadvantaged or small non-disadvantaged, and that would be minimal funding. I want to say it was 4 million for that. I just need to pull up my numbers.
Helpful. Okay, that's very impressive to have that off the top of your head, generally. So thank you. I appreciate that. Okay, that's a helpful sense. And I guess here, just a message that similar to on the drinking water side, we need agencies and folks to get their applications in. Let us know where you're at on things. And particularly, as you've seen, we have a lot of planning dollars that are available as well. So let's try to really, this is an incredible moment. I'm concerned about the time that we have to get this done, both on our staff work time that it will require. But here, the sooner we have discussions, the sooner we're already have applications, if you will, in the pipeline, even if they're just general sense, we can start to figure out how best we resource what is going to be an incredible effort these next years. So just that would be my message out to folks. And thank you again, Ms. Chase. Any questions from colleagues here? Okay.
I'll ask a question. Well,
no, please.
So 100% echo what you just said, Chair. And I thought maybe, I know this is early, but one of the things we talked about when we adopted the first 200 million was the need to do, technical assistance and some kind of a needs assessment for wastewater, since we don't have that as much, and we haven't had the technical assistance dollars in the past, at least, to the same extent as we would have now. And we haven't really done a needs assessment prior to this for wastewater. And I think given these timelines are really fast, but given that we know there's federal funding coming, and just seeing what we did with the benefit of having those numbers, the estimate of need, what that meant to being able to show policymakers the amount of dollars that really are in need to address, just basic access to sanitation really is is really important. I know staff have been working on exploring, I know that there's a lot of efforts in prioritizing and getting technical assistance beefed up, shall we say, and on the wastewater side, and also exploring, I know a number of the associations and certainly staff and regions have been starting to talk through how we might approach a needs assessment without having the kinds of resources and sort of full-blown needs assessment that was able to be allocated through the legislature for the drinking water needs assessment. So just if there is an update on that, that we feel like we could share, that would be helpful. But otherwise, maybe that could be just as follow-up, because I do think with wastewater, we don't have even the same list of not just the needs assessment, but where are failing systems, and then certainly where there real public health risk related to the septic to sewer needs. So those would just be my priorities, and I know this board has expressed that as something that we want to see. And I do know that staff are working on it and talking with people about how to approach it. So just if there is an update now, if not, it'd be great to get some update in the future.
I can give an update, and Megan can jump in if I miss anything or misstate anything. So, we looked at the potential of using the general fund allocation, and for a number of reasons, it's not going to work out. But the nice thing is we do have some funding available through the Clean Water SRF just right now that we can use and dedicate to that. So we're looking at pursuing an interagency contract, and Anne or Ellen can correct me if I'm wrong, but I'm pretty sure we'll have to come back to the board with getting authorization for that, because we'll look to do as good of a job as they did with the drinking water needs assessment, if that's possible. So because like you said, Board Member Firestone, I think it's a big gap that we have in our understanding and knowledge. And, I think it's worth, especially knowing that we're going to have some funding available coming down the road, it's worth making that investment now. So certainly we'll coordinate all that with Division of Water Quality in the regional boards.
Great. Really appreciate that. And yeah, glad that this board, we've expressed consensus around just needing to have that same thorough analysis to be able to drive the projects and the discussions, importantly, in communities, and so that we can all see the same thing. We've seen incredibly the power of data, as Board Member Firestone said, to both really identify the actual problems on the ground and best assess them, but also to highlight those communities to policymakers, to all of us, and really make sure that we're seeing our communities for the challenges that they are facing, and importantly, plugging them in here to then funding opportunities in real powerful ways. So I'm glad to hear, Joe, that you're looking to have something that is equivalent to the drinking water project, because that is so much a model here, and wastewater need not give short shrift here. It is incredibly important, and hasn't had as much of a focused program. So here, taking every opportunity to really elevate it to it, is the sanitation component to the human right to water is just really important. So thank you. And thank you, board member.
Yeah, and you also had a question about the technical assistance. And Megan, maybe you could provide an update. I know with the first $10 million, we've talked to a number of our TA providers. We've approved funding. I can't remember where we are, honestly, in terms of getting the agreements executed. But could you touch on that? And I know we didn't really talk too much about technical assistance in our plans moving forward on the wastewater side.
Sure. Yeah, we're working on 3 different proposals from TA providers, and the focus will be a lot on trying to develop septic to sewer projects. initial outreach to sort of gain, the community's input and hopefully get them on board to develop those kinds of projects and help, determine the right governance for proceeding forward with construction and all of those types of things that are sort of unique to septic to sewer projects. And so we are still working through getting agreements executed for those, but we're trying to expedite them, knowing that it's important to get the work started as soon as possible.
And I guess the other thing, Megan, is, that was with the first 10 million, but then we have up to 10% on the rest. I don't think we really touched on that very much in our presentation. I think certainly on the drinking water side, we feel like we've made pretty darn good investments in TA. So I don't know that we need to tap into this particular funding pot for drinking water TA, but on the wastewater side. So maybe you could comment on that.
Well, I mean, the IUP does give, as proposed, gives Joe the authority to authorize additional funds for both drinking water and wastewater if needs are identified. But at this point, I think we're planning to focus on that first 10 million for the wastewater side, and we can certainly add additional funds to those agreements, as we go forward.
Just a quick question. How has the coordination with our regional water quality control boards been going? This has, been a topic of conversation that the chairs of the regional boards and myself have had, just wanting their real leadership here, since they're such in a driver's seat, if you will, when it comes to really overseeing both the wastewater facilities, but then also this bridge of addressing the water quality challenges that septic communities can cause. And so, and I know there's a good amount of ownership around, communities and projects like Quail Valley and others that are longstanding here. So just, for the sake of discussion, wondering how that's going and how we can continue to make sure. And what I've encouraged, and thank you, Megan, for connecting directly with our chairs here. You've heard me encourage as well that, there's opportunity for the Division of Financial Assistance to provide just an informational item, not unlike this, but maybe more specific to then the projects and communities of the regional boards, and would encourage here as we move to adoption of the intended use plan, and maybe at some future moment there as we're actually sort of executing, if you will, the work in the year ahead, could be really worthwhile to have a very focused septic to sewer discussion, talk about the funding opportunities, and even here preview the needs assessment that we're doing on wastewater as these opportunities to better connect with our regional water quality control boards on work. But yeah, just I guess how is that going? Any insight or thought on how we can be helpful?
Well, I mean, I think just the stakeholder meeting we had an internal meeting with all the regional boards invited to discuss sort of the proposals here. And I think that was a great opportunity to sort of remind them about the technical resources that we have available, technical assistance particularly, and encourage them to, be looking at the needs in their regions and connecting them with us so that we can help move their projects forward. And I also do think that there was a lot of interest from the regions to participate in the needs assessment. And so that will be another great way to kind of make those connections and hopefully encourage, more projects to come forward and be prioritized and all of those things. And we can certainly look at doing some kind of informational item on septic to sewer at some point down the road, if that's of interest to folks.
I just wanted
Fantastic.
to add.
Thank you. Yes, please.
I just wanted to add to that I do feel like we have been having a lot more communication with the regional boards. There is a lot of interest in this funding. We've helped provide additional presentations about available funding, and we've been having multiple conversations about potential projects in their area, and there's definitely a lot more interest and a lot more communication that I've noticed.
That's fantastic, and thank you for being that bridge to those discussions. Yeah, I can't help but feel there is a good bit of excitement. We haven't had investments like this, both from the federal and state side, in 50 years since really the passage of the Clean Water Act and the Safe Drinking Water Act. And you saw huge federal infusions for a decade or so there before things, as we know, began to tail off and really shift to communities. So being able to really spark everyone's imagination, if you will, about this opportunity, that it's there, it's real, and that we're needing to all collectively make sure we do the best we can to maximize what is this incredible generational opportunity we have. So that's exciting, and thank you. I appreciate that. Other board members, please.
Yeah,
Vice
I
Chair.
have, thank you. I have just a few comments. And before bringing up a new subject, just want to, concur with the discussion that we just had about the needs assessment, and in particular, the communication with regional boards. I think that it'd be helpful also to utilize us as board members through the liaison roles that we have, and to provide just very brief updates, frequent updates on both drinking water and clean water opportunities. I've noticed that as I check in with new board members, this is a top priority, and oftentimes they have a pet project that they're interested in. And so I think just using it as an opportunity to get their feedback, and also to educate that, we really are utilizing in particular on the drinking water side, that needs assessment, and to just make sure that those projects, that they get in the pipeline and get properly analyzed so that they can be properly prioritized. I wanted to just, I'm going to bring up something that's totally out in left field, and just really using today as an opportunity to just flag an issue that I just learned about. So actually just came across my desk. I would have brought it up in my briefing, but I wasn't aware of this. But EPA has put out a set of guidelines. It's a report that came out in December. The SRF, Clean Water SRF Best Practices Guide for Financing Non-Point Source Solutions. And I'll make sure, if Mr. Carcassi, you're not already aware of this, I'm going to go ahead and forward it on over to you, and would like to have, probably a separate discussion on this. I know today is not really the necessarily the appropriate time to be opening up a whole new category. But I did want to just put it out there that I find this report to be quite interesting. Regarding possibly agricultural practices, forestry practices, and other incentive-based things. Included within the report is septic to sewer and other things that we are already doing. But it just strikes me as an opportunity to be looking for additional projects out there as we sort through the state funding and also federal funding opportunities. So I'll send this your way, and then it'd be great also circulate it around to the rest of the board.
Okay, thank you.
That's great. Thank you so much, Vice Chair. Board Member Morgan.
Hi, good morning. Just wanted to thank DFA for all the great information provided this morning, and ask for regular updates on the wastewater needs assessment. You guys know, I'm a big wastewater geek, and this is a subject dear to me. And so as we move forward, I would like to engage more with staff on this, and would like to also consider the regionalization of small land disposal systems in addition to septic to sewer projects. That's another area where there is the potential for great water quality impacts. And so I think that that's something, just as we're looking at a wastewater needs assessment, that's another area to consider.
That's a great
Board
suggestion.
member.
Thank you, Board Member.
Yeah, can you just clarify for me? So what's an example of that wastewater on land disposal?
So I can't think of a system right off the top of my head at this moment in time, but just for example, there's like early in my career, one of the first systems, well, actually early in my career, all I did was work on small land disposal systems and septic to sewer systems. So one system that sticks out to me was a small land disposal systems pond system. And so basically the wastewater just was disposed of into ponds. And so the disposal would be that the wastewater would then percolate and then gets the treatment is that it goes through just as a septic system, it goes through the earth, and that's part of its treatment. And so in order to do so, you need a certain amount of separation between the bottom of the pond and to groundwater. This particular system did not have that separation. The groundwater actually was under the influence of surface water. And so certain times of the year when the river was higher, the surface water was actually above the level of the bottom of the pond. So that treatment was not occurring. There was direct, influence and therefore, direct impacts to groundwater and surface water. So that's where, that in those other systems that, felling, small land disposal systems, there is actually, I'm trying to think of it, there's a system that DFA actually was working on when I actually worked in DFA. That was a small pond system that basically was not properly maintained and that continuously failed. So there's
yeah, that's fantastic, really helpful. And is that for both wastewater systems, like human wastewater systems and other discharger wastewater systems, or is that, and I think you mentioned regionalization. So just trying to understand the universe here. So we're, what would, it just in terms of who, kind of the ownership or purpose of the wastewater?
It's primarily domestic. And so, human wastewater systems. There could be some systems that are more industrial. But again, just as the vice chair was, speaking to the regional boards, know these systems. Yeah. They're non-15 permitting system, program. They know where these systems are. They know where these systems are failing. They know the problematic systems, whether they are domestic or they are, industrial systems that are, throughout the state, and would be able to then say, is there a nearby system? And the same that would go for like a septic to sewer system.
Yeah. Great, thanks. That's really helpful and a good point.
Yeah, board member, would they all generally fall under the OTS policy? And we don't have to get too much into it, but I'm just trying to think of like where these systems are fitting into our work generally. But yeah, okay, yeah, because I think OTS are more just septic systems generally, maybe not the larger ones, and or some of these other configurations that you're speaking of. So, okay, thank you. Other comments, questions? And we have a couple of commenters that we can go to then otherwise. Okay, then I would like to call up Jared Boskell. I think it's just Jared.
Hi, hi again, board members.
Good morning.
Jared Boskell with CASA, and a couple updates. One was a point of clarification on the earlier slide. With regards to the drinking water presentation, it appeared that the potential grant eligible applications in process for wastewater were $511 million. And so I wanted to clarify, does that mean that most of that 650 designation is already encumbered and there's only a portion of that?
No, and I think that was specific to disadvantaged communities, those numbers that you saw. And so that slide that you saw was in response to board member Firestone's question as to how much demand is out there, particularly with these adjustments we're doing for the small and medium disadvantaged communities, and what did it mean for then an ability to either cover that or what does it mean for our amount? So those were just estimates for pending applications. None of those, we didn't have a breakdown or understanding of which were complete or not, but it was an ability just to have a snapshot of, okay, what's the current demand in the program just based off of what's in the queue. Those aren't committed. It's not, it was all just to be able to demonstrate how much demand we had in the program generally. And that wasn't the full amount.
Right.
Importantly, those numbers were for the disadvantaged communities, pending projects, and at risk and human right to water systems, at least on the drinking water side. Hopefully that was helpful.
Yeah,
and
and
clarifying.
just on the wastewater side, it was just small DACs is what I think it had.
Yeah,
Great.
very helpful. Thanks for clarifying. And then just as a second item and as a point of information to Board Member Firestone's comments about the needs assessment and Board Member Morgan's comments about it. We're going to be collaborating with board staff next week in a couple of meetings with some of our members to walk through GIS files and how some of that information can be utilized in analyses with some other data from counties on septic system locations to help do some of that needs assessment. And so we have, I think, 2 back-to-back meetings with kind of 2 different groups to talk about both aspects, the methodology and the files themselves. So
Thank you for that.
yeah, appreciate the collaboration, and I can send details to both the board members if they're interested in further information on that.
Fantastic. Yeah, that's exciting, and particularly because we do want to not have to reinvent the wheel here. If there's data out there, we want to quickly be able to aggregate it and here provide it at that state level, like the drinking water needs assessment, to drive these incredible goals and opportunity that we have. So thank you for a really important role that CASA continues to play in all of it.
Very well, and a lot of respect to our members and appreciation for them to take the time. See you all later. Thank you.
Okay, thank you.
Yeah,
Really
before
appreciate it.
you go, before you go, Jared, I just thought I'd say, not only thank you for that, but I think also just for CASA and all of the associations that work with individual, both drinking water and wastewater systems. A key thing now is making sure that folks apply for this funding and move quickly on getting all the documents needed to actually get a contract in place. And so, we're going to really need partnership. And I know you already are a great partner in this, but, I think a real all hands on deck effort to make sure this money gets out effectively and folks have the information they need to be applying with this tight time frame. So thanks.
Certainly, we'll be there on the standby to help.
You're here. Thank you. Really appreciate it. Thank you. Okay, board members, any additional discussion here? This is just a workshop, so there is no vote. We're not deciding yet on the IUP, but this has been a really good exchange. But still, room definitely for discussion still yet. So anything we haven't covered that you'd like to? Okay, hearing none then. Want to appreciate and thank everyone for their great work here on the intended use plan. It is a good problem to have when it comes to just the increased resources. But as Board Member Firestone said, it's really going to be about getting applications, and these next years will be intense to really get these dollars out and do justice by this opportunity. So we appreciate everyone's engagement. Written comment is still available here till the beginning of February on this. So please do let us know where you think we can do better, and really appreciate the great engagement by everyone. With that, just looking at my agenda, we're all set. That concludes item number 12. It also concludes this board meeting. So the next board meeting will be February 1st, Tuesday at 9 a.m. And until then, be safe, be well, and look forward to seeing you all soon. Thanks, everyone. Take care. Have a good rest of your day.
Thank you. Bye.
Bye.